Today, we discuss 5 common medications dangerous for people over 70. As we age beautifully past 70, our bodies change dramatically. The way we process daily medications is no longer the same. The American Geriatrics Society created the Beers criteria. It is a vital list of medications that older adults should strictly avoid. Why does this happen? First, your kidneys filter toxins much slower. Medications linger in your system far longer than they should. Second, your liver metabolism significantly decreases with age. This means standard drug doses can quickly become toxic for an older adult. Finally, your aging brain becomes highly sensitive to sedatives. Minor doses can cause severe confusion and unexpected physical balance issues daily. The combination of these 3 factors creates a perfect storm. Everyday pills suddenly transform into hidden dangers within your own home. We are not talking about rare experimental drugs today. These are common household names you probably have in your medicine cabinet. Many seniors take these pills daily without any suspicion. They trust familiar brands, unaware of the silent damage happening right inside. It is time to uncover the truth about these medications. Let us examine the first dangerous category you must carefully watch. But before we begin, please remember this crucial medical advice. Never stop taking prescribed medications without consulting your primary doctor first. Sudden withdrawal can be just as dangerous as the drug. Always seek professional medical guidance when adjusting your daily health routine. The first category includes benzodiazepines, commonly known as Xanax or Valium. Doctors often prescribe these for anxiety or severe sleep issues. While effective for younger patients, they are terrible for seniors. These chemicals accumulate rapidly in an older adult's slowing physical system. Imagine a foggy cloud slowly filling up your entire brain. That is exactly what benzodiazepines do to an older adult's mind. The buildup causes extreme daytime drowsiness and significant memory impairment. Seniors often feel completely disconnected from their surroundings and beloved family. More alarmingly, these drugs severely affect physical balance and coordination. This leads to a drastically increased risk of dangerous accidental falls. For someone over 70, a simple fall can be devastating. It frequently results in shattered hips or traumatic brain injuries instantly. Recovery from such severe fractures is incredibly difficult and painful. Many seniors never regain their full independence after a hip fracture. The temporary relief from anxiety is simply not worth it. The long-term physical risks significantly outweigh any short psychological benefits. If you struggle with anxiety, safer alternatives definitely exist today. Talk to your healthcare provider about gentle therapies and safer medications. Cognitive behavioral therapy shows remarkable success in older adult patients. It effectively treats anxiety without introducing dangerous chemicals into your body. Meditation and light exercise also provide wonderful natural stress relief. These healthy habits strengthen your body while calming your anxious mind. Always prioritize treatments that protect your physical balance and memory. Let us move on to the second highly dangerous medication category. Medication number 2 is diphenhydramine, found in Benadryl and Zquil. It is a widely used everyday antihistamine for allergies and sleep. Because it is sold everywhere, people assume it is safe. However, for older adults, this common drug hides a terrifying secret. Diphenhydramine blocks acetylcholine, a crucial chemical messenger in your brain. This messenger is absolutely essential for learning and retaining new memories. When you block this chemical, your brain struggles to function. You might experience sudden confusion, blurred vision, and severe dry mouth. The most shocking danger comes from long-term daily usage habits. Studies show a 54% increased risk of irreversible dementia. Yes, you heard that correctly. A simple allergy pill can significantly increase your chances of losing your precious memory forever. Many seniors use it nightly as a cheap sleep aid. They unknowingly trade a few hours of sleep for their cognitive health. The damage accumulates quietly over months and years of use. By the time memory loss becomes obvious, the terrible damage is done. If you need allergy relief, ask for safer modern alternatives. Newer antihistamines like Claritin or Zyrtec are much safer for seniors. These newer options do not cross the blood-brain barrier easily. Therefore, they will not disrupt your memory or cause severe confusion. For sleep issues, we will discuss better solutions very shortly. Never rely on allergy medications to force your brain to sleep. Protecting your mind should always be your absolute top priority. Now, let us examine the third dangerous group of common medications. The third category involves non-steroidal anti-inflammatory drugs, commonly called NSAIDs. You know them as Ibuprofen, Naproxen, Advil, or popular Aleve pills. These are the standard pills for arthritis and joint pain. Millions of seniors swallow them daily just to get through life. While they reduce pain, they silently attack your aging organs. The most immediate threat is severe gastrointestinal bleeding and stomach ulcers. Older adults have a 3 to 5 times higher risk. A bleeding ulcer can become a fatal medical emergency very quickly. NSAIDs also restrict crucial blood flow to your aging kidneys. Over time, and this constant restriction causes permanent, irreversible kidney damage silently. Furthermore, these common painkillers can dangerously elevate your blood pressure. This puts immense unnecessary strain on an older adult's fragile heart. Heart attacks and strokes are real risks with chronic usage. The temporary relief from knee pain could cost you your life. We understand that living with chronic arthritis pain is exhausting. However, masking the pain with dangerous NSAIDs is not the answer. Acetaminophen, known as Tylenol, is generally a much safer alternative. It effectively manages daily pain without destroying your stomach or kidneys. Topical treatments like pain-relieving creams also offer excellent localized relief. They target the aching joints without circulating through your entire bloodstream. Physical therapy and gentle aquatic exercises can dramatically improve mobility. Building muscle strength naturally reduces the heavy burden on painful joints. And always consult your rheumatologist to create a safe pain strategy. Let us explore the fourth highly problematic medication on our list. Medication number 4 is Zolpidem, widely recognized as Ambien today. Sleep becomes increasingly difficult as we age, prompting many to seek help. Ambien promises a full night of deep, uninterrupted, peaceful rest. But for adults over 70, it delivers a very dangerous illusion. This powerful drug deeply depresses your central nervous system overnight. It causes extreme grogginess that persists well into the next morning. Seniors waking up to use the bathroom face massive risks. The drug severely impairs balance, doubling the risk of hip fractures. Furthermore, Ambien does not provide genuine, restorative, healthy human sleep. It essentially sedates your brain, mimicking sleep without the healing benefits. Users often experience bizarre side effects like sleepwalking or sleep eating. While some seniors have even attempted driving while completely asleep and unaware. The hangover effect ruins the entire following day for seniors. You feel exhausted, confused, and dangerously unsteady on your own feet. True restorative sleep requires proper brainwave cycles, not heavy sedation. Chemical knockouts prevent your brain from performing essential nightly maintenance tasks. Instead of dangerous sleeping pills, consider cognitive behavioral therapy for insomnia. It addresses the root psychological causes of your frustrating sleep struggles. Establishing a strict, calming bedtime routine works wonders for seniors. Avoid screens, caffeine, and heavy meals right before you go to bed. Natural melatonin supplements might help, but always ask your doctor. Even natural remedies require proper medical supervision for older adult patients. A safe night's sleep should never risk a broken hip. Now, we arrive at the fifth and final dangerous medication category. And the fifth group includes proton pump inhibitors, known as PPIs. You might recognize familiar brand names like Prilosec, Nexium, or Prevacid. These medications are incredibly popular for treating chronic acid reflux. They work by drastically reducing the amount of stomach acid produced. While effective for short-term use, long-term usage is extremely dangerous. Many seniors take these daily for years without medical review. Your body actually needs stomach acid to absorb essential nutrients. Without enough acid, you cannot properly absorb vitamin B12 and magnesium. Severe vitamin B12 deficiency causes devastating neurological damage over time. The symptoms tragically mimic the devastating effects of early Alzheimer's disease. Seniors experience severe memory loss, confusing brain fog, and neuropathy. Often, they are misdiagnosed with dementia when they just lack vitamins. Low magnesium levels are equally terrifying for an aging body. It can trigger sudden, life-threatening irregular heartbeats and severe muscle spasms. Additionally, reduced stomach acid makes you vulnerable to dangerous infections. Harmful bacteria like C. diff can easily thrive in your gut. Chronic PPI use is also linked to accelerated bone loss. This further increases the terrible risk of spinal and hip fractures. If you suffer from heartburn, discuss stepping down your medication. H. 2 blockers like Pepcid are often much safer for older adults. Dietary changes can completely eliminate the need for acid medications. Avoiding spicy foods, late dinners, and excess caffeine makes a difference. Elevating the head of your bed also prevents nighttime reflux. Simple lifestyle adjustments can protect your brain and your fragile bones. We have covered 5 extremely dangerous medications for older adults. Now, let us focus on proactive steps to protect your health. The most important action you can take is a review. Schedule a comprehensive geriatric medication review with your trusted primary doctor. Gather every single pill, vitamin, and supplement you currently take. Put them all into one large bag and bring them along. Your doctor or pharmacist will carefully evaluate every single item. They will actively look for dangerous interactions and unnecessary prescription drugs. Never assume a medication is safe just because it is familiar. Medical science constantly evolves, and older guidelines are frequently updated today. Ask your doctor if you still need every prescribed pill. Sometimes conditions improve, and certain medications are no longer medically necessary. Always inquire about the lowest possible effective dose for you. Smaller doses significantly reduce the heavy burden on your aging organs. Remember that your local pharmacist is an incredibly valuable resource. They are highly trained experts in complex chemical interactions and side effects. When prescribed a new drug, always ask about the risks. Specifically ask how it might affect your balance, memory, and kidneys. Advocate for yourself and never hesitate to ask difficult questions. Your health and independence are too precious to leave to chance. Family members should also actively participate in these medical conversations. An extra set of ears helps catch important details and instructions. Together, you can build a safe, highly effective treatment plan. Aging should be about enjoying life, not surviving dangerous medication side effects. As we wrap up, let us quickly summarize today's vital lesson. Benzodiazepines ruin balance, while diphenhydramine silently destroys your precious daily memory. NSAIDs severely damage your kidneys and increase stomach bleeding risks. Zolpidem causes dangerous falls without providing any truly restorative human sleep. Finally, long-term use of PP blocks essential vitamin absorption entirely. And this leads to severe neurological issues resembling advanced cognitive decline diseases. Knowledge is your ultimate defense against these hidden medical dangers. Share this vital information with your parents, grandparents, and older friends. A simple conversation about medications could literally save their life. Always prioritize safety, ask questions, and seek better, healthier alternative treatments. Thank you for watching Vital Health Guide and prioritizing your health. Stay safe, stay informed, and we will see you next time.